Hello, everyone. This is Holly Finks coming to you from Longboat Key, Florida, where we are wintering, our first opportunity to do this since retiring. I regret that I'm not there celebrating with you for the Ashland Christian Health Center and all that it has done for the Ashland community and its constituents. I remember back when it was in the formative stages. It started for me with a phone call from Dr. Roger Snyder, who I knew as a professional but did not know really personally. I'm very happy to say that that has changed, and I am always delighted in Roger's company. And at this point, really want to thank he and Perry for their consistency and love, devotion, and godliness in the adventures of Ashland Christian Health Center. We had to sit around kitchen tables in various committee members' kitchens and dining rooms and sip tea and have some coffee and formulate all of the things that needed to happen to make Ashland Christian Health Center the viable institution that it is today. We did community surveys to find out what population needed the health care that we could offer most and which were already taken care of by other maybe social agencies. Dr. Lucille Ford helped us work through paperwork and knowing all the many things that we needed to do, and then eventually becoming a 501c3 organization. We needed to write bylaws. We needed to have a vision and mission statement. Lots of groundwork, but it was wonderful, formative time, and deep relationships were developed. Every meeting was bathed with prayer first, and we often shared meaningful devotions among the committees. And you know what it is today. And I've had opportunity to have hands-on time with patients, time with the staff, and it is always a very rich time. So Ashland Christian Health Center, congratulations, and we love you, everyone that's connected with it, and the viable part that you are to the Ashland community throughout the county. And this evening, please celebrate, enjoy, and we look forward to more of God's blessings on Ashland Christian Health Center. Good evening, friends.
Back in 2001, Dave Rose, Dan Phillip, and I got together because they had an idea for starting a clinic that would be a free clinic for people without insurance in Ashland County. After a year, on August 19th, 2003, we finally decided to have the first clinic. Dr. Hess was the physician at that clinic, and as if to emphasize that this clinic really was needed, the first patient was seen in the clinic, sent to the emergency room, and then life flighted to Columbus. The thought I always had after that was whether we had been here earlier, could we have prevented that?
When I look at the mission and consider the mission statement that was written all those years ago in 2002, it's amazing that we're still at that place today. We exist to holistically care for and elevate the dignity of Ashland County residents who are uninsured or underinsured in a Christ-centered atmosphere. The Ashland Christian Health Center is a ministry served by the people of the Ashland area churches. We are a nonprofit, faith-based, volunteer-staffed organization. Our volunteers use their gifts and abilities as physicians, nurses, and support personnel to serve our patients. Good medical care takes care of more than physical health. It takes care of the whole person, body, mind, and spirit. And we, of course, can't do that without recognizing that Jesus cares for more than the spirit of his people. He cares for the whole person, body, mind, and spirit.
In the mission statement, there is a statement that we want to protect the dignity of our patients. One of the things that we have done since the beginning is we have not actually provided free care. There's a $20 fee, and if they can't pay that, we ask them to do volunteer work in the community, sort of a pay it forward. And in that way, our patients don't see what they're getting here as a handout. They do appreciate what we do, and they understand that they can't get this kind of care anywhere else for the price that we charge. But they do go out and actually volunteer in the community, and we're really excited about the list of 30 or so different activities that our patients have done to help others in the community, and it's exciting to see the volunteer work we do being translated then into volunteer work other people do. It's a place where the Church of Ashland, meaning all of the people who call themselves Christians in Ashland, have an opportunity to live out their faith by loving their neighbor, by caring for others, and by pointing them to Jesus Christ, if that is appropriate for that situation, or by connecting Jesus to their story and tell them how Jesus is relevant to their story.
Ashland Christian Health Center serves any adult resident 18 years old or older who is uninsured or underinsured. We are here to help in the best way we can. We serve patients with any general medical ailment, and we can also perform general physical exams. And if we cannot take care of your condition, we will try to arrange for an appropriate referral.
In 2009, we were excited to move from our first location at the pump house to our current location at the corner of Miller and 4th Street in Ashland. It enabled us to provide so many more services. We now have a durable medical equipment bank that provides to patients who can't afford. Also in the building with us is the Patient Medication Assistance Program, which has actually been in existence for as long as we have, to help people sign up to get medications from the companies that make them when the medications are way too expensive for them to afford. We also had a room in the building that was perfect for a pharmacy so that we can provide medications to our patients. We also have now a social worker who comes twice a month to help deal with some of the navigation of the health system issues that our patients deal with.
I love this place because it makes room for me. It meets my needs, it allows me to be me, whether it being a patient or a board member or a Bible study teacher. This is a place where everyone's welcome. They're appreciated and they're valued. They get help and they get to give help at the same time.
I was doing some street evangelism and it was starting to get cold outside, so I was looking for an opportunity to be able to minister to different people.
I really like being able to meet the different people and in the waiting room and hear about their needs and their problems. Usually they've had some difficult situations. We're usually able to hear a little bit about their life while we sit in the waiting room with them. I try to pray with them, and oftentimes it's led to a chance to share the gospel with them too, which will give them their ultimate hope.
It has such a great camaraderie between the staff, the doctors, and the volunteers. Everyone has a great attitude, very jovial. They work well with one another, interacting in such a way as to set patients at ease, and really it makes the patients feel not only welcome but loved, and helps them to recognize that this is a resource that they can fall back on.
It's a real privilege and an honor for me to be a part of the Ashland Christian Health Center. I've lost track of how many years we've been doing this together, me and my wife Sharon. She's a registered nurse on staff here and has brought me in with her. It's been a real joy and a blessing to me, as I said, just to meet different people here and to have an opportunity to get to know them and share Christ when opportunities present themselves.
Ashland Christian Health Center, I've been involved with ever since they were started over in the pump house, and I've been going to them all this many years because I never had any insurance since I become older and out of work. They've supported me and given me everything I needed to survive all these years. I don't know what I would have done without this facility being here. I've helped them as many ways as I can, and they've helped me even more. I just thank God that the doctors are willing to come in here and give up their time to help us people that need their help.
People really need to get involved with the Ashland Christian Health Center. Dr. Hess, and she's deceased now, and Dr. Snyder, they saved my life, and I appreciate it when no other doctor would help me. Christianity and good doctors and faith and help what you're supposed to do in the community. So stop in and really, really get involved and talk with Dr. Snyder and his staff.